Mr. K?
Yes, that was chapter 12. All right. Now, sedative hypnotics chapter. It says drugs for sleep is what the titles the chapter is, but we say it's sedative hypnotic medications. And we say that sedatives in general are to do what? Relax your patient. Hypnotics are to
Sleep.
right, change the level of consciousness, produce sleep. Okay. Won't go over to that. Stages of sleep. Understand we have REM, which is rapid eye movement. What happens in REM sleep? Dreams. And then we have what others? How many other stages? 4 stages. As they progress, they get more deep as they progress. And then which stage is affected by these medications? So, correct. REM is well, 4 is also affected. But Grace, you're getting too deep in. But REM is definitely affected on these. Can you die from a lack of sleep?
Yes.
Yes. So MI, CVA, TIA, all these that can occur from a lack of sleep. Where is that? Okay. Let me do this one first. I'm jumping around. So what is the difference between a sedative and a hypnotic? We already said one relaxes, one does. Can any drug be a sedative or hypnotic? Yes. So it's based on the dose and the patient's response. Good. All right. So I'll go back to here. So before I give a sedative hypnotic, what do I need to assess first before I give it to them? Do they actually need it? Maybe some light music, turn off the lights, move them away from the patient that's screaming and yelling in the room next door. Maybe that'll work before we just throw a pill at them. Okay? So try something non-pharmacological first. Make sure there's an actual need for it, right? And what if I give someone a sedative and it does the opposite effect? What's that called? Paradoxical effect. Good. And what should I not take with any of these drugs that are considered CNS depressants like this chapter? Alcohol or any other CNS depressant I should not take with it. It can make it more toxic is what they're at risk for. Okay, let's move over to here. What is an over-the-counter drug that can actually be used as a sedative or a hypnotic? Benadryl. Diphenhydramine, however you're going to say it, but that's Benadryl, right? D-I-P-H. Diphenhydramine. There, I had to sound it out. Benadryl. How long can you take that for if you can't get to sleep? 1 week. You should not be taking it longer than that week-long period. And barbiturates, do they have a short half-life or a long half-life? Long. So therefore, your risk at becoming toxic or overdosing, right? We say hangover effect. The fancy word for that is called residual daytime sedation is what they're going to have. Barbiturates end in barbitol. Isn't that a shaving cream, barbitol? I think it is. There you go. So if it ends in barbitol, the 2 main uses for these drugs are seizures and as an anesthetic, as a general anesthetic. Okay, and it's on the it's in the what do you call it? Lethal injection cocktail. There you go. All the stuff you're going to see for side effects. These are common side effects: blurred vision, hypotension, right, when arising. So orthostatic hypotension, they're going to be tired. They're going to have a headache. Good. And then if they stop taking a barbiturate, what are they at risk for occurring? Just like alcohol. Think of it like alcohol. Same similar side effects. So if they take barbiturates for a period of time and they stop taking it, what are you going to watch your patient for? Withdrawal symptoms, right? And I heard tremors, I heard all that kind of stuff. Remember, they can go through the same withdrawal symptoms as someone coming off of any other depressant. So we're going to monitor for that. And then those withdrawal symptoms now we see are going to be, because it's a depressant, what is the withdrawal symptoms going to be? Up here. So shakiness, anxiety, right? And then the worst case scenario is they're going to start having a seizure or they're going to start having psychosis. That's why they call it delirium tremens is what they refer to it as. Psychosis and also the shakes and the seizures. All right, benzos once again end in AN. Good. And these are used as an anticonvulsant, PRN, we already said. Anti-anxiety, so they're for anxiety. And they're also, can they help a person go to sleep?
Yes.
Are they used for chronic? No. So they're not used as a chronic hypnotic. They're not used for chronic insomnia, but they can help induce sleep. Okay, help facilitate or induce sleep. Understand all the reasons why benzos are better than barbiturates. You're less likely to overdose. The levels have a better safety range. Stages of sleep are not affected as much. And then benzos work more selectively, whereas barbiturates work entirely on a lot of your body. already said all that. Are you going to monitor blood pressure for orthostatic blood pressure again?
Yes.
Yeah, always. Just do it always. There you go. Which organ can be damaged again by the benzos? Liver. So what's the test? Liver function test. And what are the two enzymes now that we have added on? AST and ALT. Good. So, and the symptoms? Nausea, vomiting, jaundice. Good. And the non-barbiturate, non-benzo, which is called chloral hydrate. Okay. Which drug does it interact with? Coumadin, warfarin. Okay. So if they're taking that and they're taking warfarin, which lab am I going to monitor? Which is the long name? You got to know the long name for prothrombin. Oh, I just said it. For PT is prothrombin. Good. And INR. Okay. And you also have to take it with a full glass of water. Good. What's the antidote for benzo overdose? Who knows this one? Without looking at your notes. Flumazenil. Flumazenil. There we go. Now we got through it all. Good. All right. All done.